Thank you for being here today. I relocated from Minnesota to Arizona in the pandemic, so I didn't have the opportunity of meeting a lot of people. I'm excited to see so many of you, and thanks to Zach, and learned so many of you have crossed paths with Alzheimer's disease and dementia. And my work specifically focuses on Alzheimer's disease. I just want to emphasize, when we talk about Alzheimer's disease nowadays, we are talking about pathological changes that's happening in the brain. So people may not have symptoms, period, or they may have a lot of symptoms. So what's happening in Alzheimer's disease are two major changes. One occurs outside our nerve cells or neurons. It's called amyloid plaques. And the other one is inside the neurons, called the tangles. The plaques is like a little clumps within the environment. So if you think about it, the cells needs to get nutrients, get the waste out. But when there are clumps in their environment, they couldn't do that effectively anymore. And within the cells, there are little structures that support the cell. You see them like a round or different shape. And those are called microtubules. They are like little tubes. So they can get nutrients in, they can get waste out. But the neurofibrillary tangles crumble all those tubes, so they don't have a way to get their nutrients and get rid of their waste. So those collective changes eventually damage the neurons. And when we do imaging of our head, we see the pinkish structure on the outside of the brain, the volume goes down, or the volume shrinks. So we begin to experience cognitive symptoms. So typically when we talk about Alzheimer's disease symptoms, we talk about three major changes. One is cognitive impairment, and the second is cognitive impairment that's severe enough to cause a functional decline, that you can no longer do your job, or you can no longer do your social engagement. Eventually, we may not be able to do our activities of daily living. And the other one, also alluded to by Derek, is behavior and psychological symptoms that people receive a lot of antipsychotic medication for, often the most troubling aspect of caregiving. So clinically, when you look at what happens to people when those underlying AD pathology is happening, so initially, as the pathology changes, we have a large brain reserve, so we don't see any symptoms. We are acting just normal. But as that pathology builds up over time, we begin to feel, oh, my cognition isn't as good as before. And I can see a cognitive decline. I used to be able to do this. Now it takes me twice the amount of time to do it. And as that progresses even further, we enter into the clinical stage called mild cognitive impairment. And by this stage, if we go to do a neuropsychological testing, we actually see our cognitive function decline. We score below the normal ranges for our age and education. And then if it goes further, we enter into the AD dementia phase, where our activities of daily living, like cooking a meal, do laundry, or even toileting, bathing, taking care of our basic needs, gets impaired. So those are the three phases of Alzheimer's disease: clinically, preclinical, mild cognitive impairment, and AD dementia. So what do? I'm a nurse by training, so I have always loved older adults, but I got into dementia somewhat serendipitously, because when I work in the hospital, I discovered how little I knew about dementia and cognitive impairment. So that's why I came to the United States to pursue education here. And then here's my vision for dementia: to develop interventions that could change this process by making their function and cognition stabilize for as long as they could. And then when they decline, it will be a faster decline over a shorter period of time. That means the nursing home placement can be delayed, and they will have better quality of life, better function. So I have been doing intervention research since 2003. I've done many research. I just want to talk about one of them. So my main way to change that declining trajectory is through aerobic exercise. because there have been growing evidence linking physical activity and exercise to reduce risk for Alzheimer's disease and delayed onset of Alzheimer's dementia. And in clinical studies, this was one of the reasons I got into this. In healthy older adults where they have their cognition relatively intact and normal, when they engage in aerobic exercise, their cognition can actually be improved, even when people are healthy. So, and in the animal studies, they also showed the pathology I showed you. They were able to see changes in those pathology in mice models of Alzheimer's disease. So all this evidence from different fields are supporting the possibility of aerobic exercise might be helpful in delaying cognitive decline, in slow down the process of AD. So that's why I launched in this field. The FEAD SMART trial is my third clinical trial supported by the National Institutes of Health to test aerobic exercise. So in my previous research, I has shown that exercise actually does improve, maintain cognition as we hoped, improve their functional level, and actually have a rippling impact on family caregivers, which Zach talked about, the burden the caregiver feels. And the caregivers, even though they are not my research participant, they were telling me that caring for their loved ones becomes so much easier because of their improved function, better cognition, and their emotional well-being is also improved. So this is the study we are actually running right now, recruiting participants who have subjective cognitive decline, or they have mild cognitive impairment, or even in the early stage of AD dementia. We are testing whether or not we can improve response to exercise by changing the intervention midway. Like we'll identify people who didn't respond the way we hope they will respond and change them to a different program to see if that improves their responses. This is a quick look at the screening process. So we have a phone conversation initially, then people come in to do their consent, and we do some testing, and then they will do a brain imaging to make sure their cognitive decline is likely due to Alzheimer's disease. And then if they meet the criteria, they will be enrolled. The study is 1 year long. They get 6 months of supervised exercise. Will basically have their own personal trainer for 6 months, and then they will do their own exercise in the following 6 months. And Hector Cervantes, who is right there with his hands up, is the project manager. Both him and I, we will love to talk to you after this and connect with you if you think you may be interested or interested in other things we are doing related to Alzheimer's disease and dementia. Thank you so much.